My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are really thrilled to have Dave Kerrigan, the founder and CEO of BenefitPitch, on the pod. Dave, welcome to the show.
Thanks for having me, Norm. Really good to be here.
Yeah, it's great to see you again. Saw you a few weeks ago, not only in Vegas for Transform, but also for Conference Board West. So always good to see a familiar face out, in the throngs of people. But for all of our listeners that don't know Dave, BenefitPitch, the company he founded, aims to help fill a gap in the market to connect impactful companies with benefits teams who are looking for them. Dave's a former licensed insurance broker. Dave's also the founder and current managing director of Sante Nasc and was the principal of health exchange solutions at Conduent. Was also director of business development at Massachusetts Health Connector, AVP of human capital practice at Willis Towers Watson, and was a consultant at Blue Cross Blue Shield of Massachusetts, and also was a senior account manager at Optum. So long career in healthcare before starting his own business. And Dave is working as a mentor and advisor to startups, as well as helping benefits professionals find world-class vendors and solution partners. Very excited to have you on the pod.
Love it. And I was going to joke and say I also played, this role in the second grade play if you wanted to capture that too, but you might be going a little bit too far back with that one.
Love it. Good stuff. So Dave, what inspired you to kind of, enter the healthcare world?
Yeah, I joke that I'm older than I look. So I've been in the benefit space since I graduated college in 1997. So whatever number of years that is, we're coming up on 30. Most of my career has been in the healthcare space in some way, shape, or form. I was one of those weird kids that, freshman year, first semester of college, I declared healthcare administration a major, and that was it. I would never look back. The business of healthcare has always fascinated me. And I think it's because my dad was a hospital administrator for years. And my mom is a retired nurse. And so when you're in a household where you see kind of healthcare, two different sides of it, and business in general always intrigued me. So I thought business was interesting, but the business of healthcare was even more interesting. So I ended up declaring that major, and just about every job I've had, with the exception of one, has been in the healthcare field in some way, shape, or form.
That's great. Yeah, I grew up very similar. My mom was a nurse. She retired a couple of years ago, but she was in academics and taught nursing for decades. And then my dad was in, medical law. So same thing. Came home, dinners, family vacations, always talking healthcare. So we were just bred to enter the industry at some point. So walk us through your experience at Optum in the early years.
Yeah. Optum was one of those interesting gigs. If you know anything about Optum, they weren't always Optum. They used to be known as Ingenix. And I joined, in the short time I was there, about 2 years, I had, I think, 3 or 4 different business cards. And the reason why is because they're just like they are now in acquisition mode in a lot of cases, the acquiring company. So I was hired by a company called Symmetry, which was a grouping technology company that kind of did, efficiency and risk prediction, stuff like that. They were acquired by a company called IHCIS, Integrated Healthcare Information Systems.
Yeah.
Which was then acquired by Ingenix. Now Optum.
Yeah, not the best name looking back on it, hindsight being 2020, but at the time that was, a name recognizable company. And that's the first thing you thought of when you heard those sounding words.
Yeah. And what I was doing was interesting. It was this, grouper technology that was embedded in other software solutions to kind of look at claims data and try to determine risk prediction. And, even to this day, the folks are still trying to get this right. So it was fascinating to me that I was working in this value-added reseller channel, selling to other software companies, technically competitors to the Optum product, for, companies like, HDMS and others that are still around today. And it was a 2-year stint. I was a national kind of a traveling business development representative. Every one of these value-added resellers, no matter where they were in the country, was, my responsibility, along with my boss, and the two of us were this kind of, 2-person wrecking machine trying to get out in front of as many as we could.
And then you moved from Optum to Blue Cross Blue Shield of Mass to focus on consultant relations. What were some learnings there?
Well, first thing, I had to become a licensed producer. So that's
Hmm.
when I first became licensed. And I think that the complexity of what you don't know, I mean, everyone has, insurance in some way, we hope. And if they do, navigating it can be challenging. But navigating a big company and all of those inner workings was really challenging to me. I remembered part of what we needed to do is anytime there was a new, opportunity, a company was with one carrier looking to use Blue Cross Massachusetts, the first thing we had to do was take the existing plan design and try to match it. And it was a
Hmm.
matter of like, all right, contractually, do we have this rider filed? Can we change the product? Can our system code it? And all of these kind of gates needed to be, gone through just to get to, yeah, we can do this. We can quote this. We can try to win this business. And then not to mention, that's where I learned about the value of brokers and consultants, because our channel there worked exclusively with the big consulting houses.
Yeah.
And the role that they played in all of that became apparent to me right out of the gate. So that was where I think a lot of my career started to shift from a trajectory standpoint strictly into that insurance side.
Yeah, and you started at Blue Cross Blue Shield of Massachusetts working with consultants and leading consult relations over there. And then you decided, hey, I'm not going to just work with them, I'm going to join them. And you moved over to the consultant side over at Willis Towers Watson. Kind of walk us through why you made that move and how that has since impacted your career.
The fun part of that is I was, again, back to that it's kind of a testament to what's happening in our industry and has been for
Hmm.
what feels like 20 years. I joined, HRH, Willis HRH. And at that time, they were kind of going from like the Willis and the HRH sides coming together. And then we
Hmm.
started calling it Willis HRH and eventually dropped HRH. And then I left and then it became Willis Towers Watson. But I was hired there because I'd done a lot of work with Willis HRH, Willis Towers Watson when I was at Blue Cross.
Yeah.
And while at Blue Cross, that was when my wife and I had our kids. We had two kids. We have two kids that are kind of back to back, 15 months apart.
Hmm.
And so prior to having kids, my wife worked. After having kids, she stopped working. So I went from two salaries, two people, to one salary, four people, four
Hmm.
mouths to feed. And one of the opportunities that I saw was the consulting side had a real opportunity from an earnings standpoint. And frankly, the world of a benefit consultant, boy, oh boy, I don't think there's a dull day. I mean, every day you're challenged with something new, something you got to learn, something you got to solve. And if you're not kind of that resourceful person, it's a tough go of it. So that
Hmm.
was one of the draws. It was, a better opportunity for me from a growth standpoint, new toolkit, learn that whole side of the business. And it's funny, when I joined Blue Cross, someone said, "Oh, you joined the dark side," and then I joined Willis. You joined the dark side, and I'm like, I don't think there's a light side in some cases,
Yeah. Well,
right?
what is the light side? I'd love to hear it.
I don't know. Still figuring that out. I'll let you know. I'll report
Yeah.
back if I find it.
Love that. So walk us through, how long were you at Willis Towers Watson or Willis
Yeah,
at that point?
I debated if I wanted to tell you this. As much as I work with brokers, consultants today and really love this space, I was a terrible consultant. I was technically a producer,
Uh-huh.
and I did about 18 months working to grow that book of business and was just banging my head against a wall. And it was a testament to me in a lot of ways that I was trying to compete with some of the smaller firms. And we were Willis, bigger firm at the time, Willis
Mhm.
Towers Watson now. Employers really feel comfortable with their brokers who
Yeah.
no matter who they are, small, mom and pop shop, large firm, it was incredibly hard to win business. And I think if I'd stuck with it, I would have won business. But I was still on that kind of like, mouths to feed, trying to earn, trying to
Mhm.
grow. And had this opportunity to join the Massachusetts Health Connector running their small group shop exchange. And it was just a little bit too interesting to turn down.
Yeah.
And I'd still be working with brokers. So it was kind
Yeah,
of a
that's
no-brainer.
great. I guess in your 18 months at Willis, do you remember any specific vendor pitches that just stuck out in the
Yeah,
very early, years of digital health?
you bring up a great point. I've been a geek of that kind of startup space for a while. I've always enjoyed it. And it was around
Mhm.
that 2010, 2012, which was around Blue Cross, Willis Towers Watson. That's when I started, finding these accelerator programs. But I remembered there was a company. The company was called like White Glove Concierge Service. And it was this really interesting telemedicine
Mhm.
with nurses. And this was 2010. So not like super, super early, but it was like telemedicine, but virtual telemedicine and in person. And it was designed to be this, you have a kid who's got a sniffle, rather than spending all day in the doctor's office, call the white glove concierge company. It had a really long name. I just called it white glove concierge. They would hook you up with a nurse practitioner. Sometimes they'd ask the symptoms. If they could, they'd prescribe, antibiotics. It was for that coughs and sniffles, nothing acute or emergency. But I thought that was fascinating, and the dollars it could save, and the absenteeism it could reduce. It really became an interesting thing to me. And I'd say the other one was Best Doctors. I actually got to know Evan Falchuk, who you might have even had on this podcast.
He's been on the pod. I know Evan well. He's great.
Evan and I both in the Boston area and are friends, but I met him for the first time when I was at Willis and learned about what Best Doctors is doing and love what they were doing back then. As we know, they got acquired by Teladoc along the way. So yeah, those are probably the two coolest things that I saw when I was at Willis Towers Watson in those early days there.
So talk to me a little bit about the Massachusetts Health Connector. You're working with tons of small group brokers in the Commonwealth of Massachusetts. What was that learning experience like after being at like one of the bigger firms at Willis?
It was probably one of the most fun jobs I've ever had. It was a learning experience and a half for so many reasons. So one is the broker side, which we'll touch on, but I do want to mention that like Massachusetts was the pioneer in getting folks covered under Chapter 58, Mitt Romney. Massachusetts led the way. And then I was at the Massachusetts Health Connector beginning in 2012 through 2015. And that was when we switched from what we call Romney Care to Obamacare, right? That was when the transition happened. And my role was not on the individual side, although I did help kind of establish their navigator program, things like that. My focus was on the small group side, which, they hired me to be a business development director. It was the greatest opportunity for growth because at the time, Massachusetts had 98% insured. So there was not a lot of extra growth that was going to happen there. So I was thinking small group side. So boy, did I kind of learn, at the time, Massachusetts had gone out back in 2008, 2010. We don't need brokers. We're going to go it on our own. And it was like, oh, that was a mistake. So when I arrived, I was like, we are going to work with the brokers, like hands down, this is what we're doing. And so my job was to kind of rebuild any bridge, or frankly, build it for the first time. And I guess it would be the analogy. So it was a matter of who are the key players in the state. A lot of them were, regional firms. Some were really small firms, mom and pops, generations, passed down to different kids. And so I had to get out there. Hey, I'm a licensed broker. I'm here to be your friend now. Like, we're going to do this the right way. We're going to have our, products and things do this. And we're going to, it was a lot of that. Plus, getting to know the challenges that small group brokers faced. It was a really kind of a contrast to what you saw at a bigger firm like Willis. All the resources in the world at your fingertips at these bigger firms, but these smaller firms generally weren't, punching above their weight. And that was, by the way, a little digital heavyweight pun right there. But they were working with groups, 10, 20, 50. A big group was like 200 lives, some of course bigger, but this wasn't the 500 that some of the bigger firms chased. But how resourceful they were and are still was really what got me. These brokers are just so, every time you think that they're going to get counted out, there's going to be an exchange. We don't need them. There's going to be this. We don't need them. They find a way. They find a way to stay resilient, to stay effective, to be that trusted advisor. And it always fascinated me.
Yep. And then at Buck Consultants, you headed up their vendor strategy. Walk us through that experience and how easy or hard that was to really build out.
Yeah. This was another really interesting experience because the exchange side of things, as we know, exchanges kind of bubbled up. And then I think exchange now is just a technology enabled way to purchase health benefits. Like exchanges were the buzz back then, right? 2015, around this time. And Buck had a really unique model where they called it their quilted network. And it was effectively, they did an analysis of all the deepest discounts from all the major insurance carriers in every, major metropolitan area, 3-digit zip code. And so when an employer was like, we're thinking about working with the Right Opt Exchange from Buck, analyze their claims data, and it would go like, all right, we could save you this much in year one. So it was a real no-brainer there because of this quilted network. You were automatically put into the health plan that had the deepest discounts and had the best kind of costs effectiveness for that employer. You didn't get to choose. I'm in Boston and I wanted, Blue Cross Mass. They were like, nope, sorry, it's Aetna here or whatever it is.
Yep.
Where I came in is they had already set up the relationships with the big carriers. And as they grew in certain regions, my job was to bring on regional blues as well as manage their existing vendor strategy for all of the, what I guess you just call kind of the ancillary services. So they had, a wellness vendor, they had a labs vendor, they had, a navigation vendor. So all of these vendors were hand selected, many of them before I got there. So my job was, how are they performing? Are they doing what they're supposed to? And then when contracts renewed, and this was a fun thing. I think I joined in 2015. It was year 2 of the exchange. By that next year, I had to work on renegotiating kind of top to bottom contracts with Aetna, Cigna, Anthem, all of these other solutions like the wellness vendor and this vendor, all by January 1st of whatever the year was, 2016 or 2017. Yeah, I'm getting my years mixed up. But build these relationships, get to know their business, bring on new blues plans as we could, renegotiate the contracts for the 20-something vendors we already had under contract, keep the exchange, moving forward. It was a really, really, challenging but fun and fascinating sort of a job. Really enjoyed it.
What were the greatest challenges and what are the successes you're most proud of from that time?
I mean, trying to negotiate contracts with every major insurance carrier and every point solution that was part of the exchange. We knew it was coming because they're like, Dave, you're hired. You're going to do this. You have to, bring on new blues plans and manage this. But put this bogey on your calendar. This date, we need to have every one of these contracts renegotiated and these folks re-signed up. And the employers that had bought into this exchange concept, we really couldn't have any of the carriers drop out. If they came back with ridiculous double-digit increases, we kind of had to talk them back down and say, listen, this isn't going to work for anybody.
Yeah.
And I think, that challenge was immense. We got it done. And I think that's the success side of it, is that we got it done. And also the relationships that were forged with these vendors, with these carriers. It was kind of a nice way of seeing the industry work together on behalf of the employer to make sure that this exchange idea that we were working on at the time was going to be put in the best position for success long term.
Yeah, I don't think many people probably envy your position of having to negotiate with health plans. Anyone who's ever done that, not much fun.
Let me tell you a quick story. This again gets to that relationship side of things. I remember we were working with a major carrier. I'll not name who it is. My boss at the time, we were in a situation where we were in the right and we could have kind of just bowled over them and been like, listen, you need to do this, just get it done, and just kind of strong armed them. And I was slow rolling it. I was relationship. I was like, let's do this. And my boss is like, just get it done. I'm like, I'll get it done. I'm going to get it done my way. She kind of critiqued me afterwards saying, Dave, you could be more assertive. You could be more forceful. And I've been told I'm a friendly guy. I'm a nice guy.
That's a good thing.
It is a good thing. I'm a businessman as well, a business person. And like when push comes to shove, we got to negotiate. We're going to do that. But to me, this wasn't a hill to die on. So I was like, we're going to take our time with this negotiation. So we did. Relationship intact. My boss kind of said, all right, you got it done. Took a while, but you got it done. Well, fast forward a year. This is one of those scenarios. They came back with like a % increase. And the claims data supported a big increase. It was sad to see. But the fact is, we just couldn't have it. We could not roll out after the first 3 years of this exchange experiment to these employers. Sorry, anyone who's involved in this carrier, you're going to get 20% increase.
Yeah.
And so I remember going back to my contacts and just saying, I need single digit. And they're like, based on what grounds? And I said, relationship, partnership. And that's what I said. And they laughed at me. And I said, I'm being serious. I said, we can't have it. We're going to, this whole experiment kind of has a problem. And I said, we'll do what we can in later years, but we need, 9.99% or less.
Yeah.
And we got it done. To their credit, they understood. And I remember the actuary, the underwriter, everybody was like, are you serious? And I was like, yeah, I'm being real serious. But that was the same carrier I could have bowled over a year earlier, and I didn't. Yeah. And so I think it helped that I was coming to them, hat in hand, just like I could have done something before. I didn't. I took my time with it. So this is a relationship business, and I think it made a difference in the long term.
You got to pick your battles always. And I think that's a great lesson for anyone in business. How have you watched the landscape of healthcare benefits change from the mid-2000s to the emergence of thousands of startups?
If you look at the history of kind of where startups were growing in the past, it wasn't VC dollars. That kind of, genesis happened in those 2000s and then into the 2010s, 2020s. And, billions of dollars with a B being put into this digital health area and healthcare in general. So the proliferation of vendors, point solutions, really, that plus I've seen this general shift. Back when I was doing the Willis work, it was if they're over 500, you might talk to them about self-funding, usually 1,000 or more. That's when you start talking
Yeah.
self-funding. These days, I mean, geez, I've heard of self-funding products down the lives of, 10, 20, 30, 50 lives. And I'm like, holy mackerel.
That's a
Right.
lot
So
of
there's
risk.
just been this intense shift towards, well, I mean, listen, we can get into all the misaligned incentives in healthcare in general. The way that the business of healthcare has devolved, you could argue in some cases. It pushes for creativity. So you've got folks saying we can self-fund down to 50 lives. We can plug in standalone this, that, and the other thing. I remember, again, back in the Blue Cross days, don't carve out pharmacy. If you carve out pharmacy, you can't control things. Well, in fact, you can if you have the right reporting, the right partner, et cetera. So I think what you've seen is the increases in premium and costs in general has just forced the industry to continue to get creative. I'm not saying we're doing it right or wrong. I'm just saying it's forcing this creativity. And all of this proliferation of point solutions gets to the very fact that like health plans have evolved to do everything, but are they effectively doing everything?
Yeah.
You could argue, no, that's why the point solution genesis happened. And all of these other vendors said, we can control musculoskeletal costs better. We can control these disease states better. And then employers with their brokers say, yeah, this makes sense. You can save us money. Let's do it. And so you start to see employers taking a more active role with their broker riding shotgun. How can we make this better for our employee population?
Yeah. It's a very unique area that, we obviously have a lot of fun in. And you're maybe one of the probably 5 people on this planet that I'm like, you probably know all the vendors better than I do in terms of like who does what and that company name, like what do they do? Like just out of memory and, doing this long enough. So I take that very seriously. So you do a lot of volunteer work and advisory work at startups. You're very involved in Thai Boston, serve on the Health and Wellness Advisory Council for Social Enterprise Greenhouse in Rhode Island, and are also a mentor at Mass Challenge Health Tech. Walk us through some of those experiences combined with your work experience and what led you to, found Sante Nasc and BenefitPitch. And is that the right pronunciation?
You're pretty darn close. Sante. There should be an accent on it, but fun fact, I couldn't figure out how to do the accent on the keyboard, so I just put it in. Sante is a French term for health.
Okay.
Nasc is a Gaelic term for link or connect, and I happen to be French, Canadian, and Irish.
Awesome. All right. So
there's the genesis of that company name, right?
I like it. Yeah. Walk us through how all this, advisory and volunteer work, plus, what you've done on an entrepreneurial front, all kind of meld and blend together.
Yeah. I don't want to get too dark, but there are 2 like big life events that happened that looking back, I don't think either of them were really prominently like, wow, this happened, so I should do this. I think it happened. I took some steps, things happened, and then it led me to where I am. But it's the retrospective look that I said, I bet you they both kind of were related. Back in my wife and I lost my mother-in-law to a car accident. Very, very sad, very sudden.
Really sorry.
And I just remembered that was the first kind of person other than like maybe a grandparent that, was close in our lives that had this impact. And at the time I was at Willis, I'm pretty sure I was at Blue Cross or Willis right around that time. And, I don't know, it flipped a switch in me. I just started getting more curious. I started blogging. I started getting involved in local events in Boston in the startup space. And I just thought it was interesting to learn about companies that impacted these, the space that I was, becoming so passionate about. And fast forward, I work at Willis. I work at the Massachusetts Health Connector, Buck Consultants, Xerox. While I'm at Buck Consultants, my dad, who I think any father in their child's life is an influential character, but he became sick, Parkinson's, dementia, and over the course of 7-8 years, just slipped away. Passed away back in, I guess it was July of 2016. And when I went back to work after that, I think that any sort of, meter I had for BS or tolerance for like corporate politics and just that stuff that happens in business.
Yeah.
I just I didn't have it anymore. Like whatever filter, whatever tolerance, it was just gone.
Yeah.
And I just remember going, things have got to be better than this. And so I started thinking at the time, maybe I should start my own company. I decided to file the paperwork for Sante Nasc as a side business, doing advisory work for early stage companies. And I filed the paperwork in January 2nd, 2017. January 13th, less than 2 weeks later, on a Friday, so Friday the 13th,
Yeah.
before a major meeting with Anthem, my boss pulls me aside and says, "Your position's been eliminated."
Oh, geez.
Yeah, we had that was when Carl
Decision was
Icahn.
forced upon you, and when you look back,
Well,
you're like, thank God it did. But
it
like,
was
I'm
that
sure
kind
at
of
the
deal.
time,
Yeah, it's Carl Icahn snatched up a bunch of Xerox stocks, decided they were going to spin it in a conduit. I was a big salary without a book of business attached to it. First guy cut. And it was a blessing because it went from Sante Nasc, we're doing this full time, to maybe we should build software because building software would be better than just consulting projects. So I was doing work with NFP's Innovation Lab and learned about all the different vendors and ecosystem. I'd already been doing that. Long story short, I kind of said, well, what if I could build a tool that was useful for benefit professionals to find the different solutions out there? So version 1 of BenefitPitch came along in 2018. Talked to a bunch of brokers and consultants about what they really needed, and ultimately landed on they need something that manages this across the country for their entire firm, and decided to build BenefitPitch from the ground up, re-platform it in November of 2020, spun it into its own company. And so Sante Nasc still exists, it's still business consulting. I still do projects here and there. But the BenefitPitch side took off November 2020, signed my first contracts. 2021 launched, USI, Assurex Global, Brown and Brown, and then it just has kind of gone on from there.
Yeah.
Vendor management system for brokerage firms to capture vendor information.
And walk us through the impact and the focus at BenefitPitch currently going forward.
Yeah, it has been pretty tight since that 2020, 2021 timeframe, but we have kind of evolved in a way to do more. The vendors create their really in-depth profiles full of what I call basic RFI level data. The vendors create these profiles, accept terms and conditions, own the profiles, manage them themselves. We don't do any website scraping and pulling data from, saying this company exists, but we don't know who owns the profile. And then creating the vendor management system around this vendor data for our large brokerage firms. That was the secret sauce that really launched us into, where we are now, which is 17,000 plus benefit professionals across the country using the software. And I think we're just under 1,400 vendors and point solutions that have created profiles.
It's a ton, especially in 4 years?
Yeah, about 3.5. So 2021 and 2024. So yeah.
It's awesome to see.
Yeah,
it's really great.
Fun. And the industry kept saying we need more, so we built another software product that's integrated called Smart RFP, which is our RFP technology, which lets you create an RFP from scratch instead of just using our vendor data that we collect on our own. So you can get deeper into a specific vertical and questions related to it. And that's just getting started. We get our first couple of contracts, and more folks are interested in tire kickers or poking and looking. So yeah, it's been fun.
How do you partner with benefits consultants?
This was where, when you really pay attention to what your customers need, and you're willing to take the risk, I guess, to build what they want, it was really clear that they were telling me, Dave, having a site with all this vendor data is great. What we really need is like all of the stuff that we don't manage as a brokerage firm, as a benefit firm, in any organized way, shape, or form right now. All of these, beauty of a brokerage firm is there's a lot of independence to do what they want to do, but that independence plus the fact that the benefits industry has been acquiring brokerage firms, so all of these brokers acquiring other brokers, leads to these silos in all of these different regions. And if you're a vendor trying to sell into the brokerage space, God bless you. I say it's like Groundhog Day, right? You talk to one broker, one office, one firm, one broker, one office, one firm. You got to talk to every broker in every office at every firm. That's how you get growth. And they're like, we only have this many people. We only have this much in runway. And I'm like, yeah, I know. It's not pretty. So what we wanted to do was solve the problem by building a vendor management system around the vendor data for the brokers and then license it at a national level. So solve the problem nationally for our big brokerage firm customers. And then they all come into the system. The vendors then, we'd already recruited a bunch in. I'd go to conferences all the time, meet vendors, try to get them to come in. But a lot of our brokers, because they use BenefitPitch as their vendor management system, if you're a vendor knocking on a broker's door and they're one of BenefitPitch's customers, they're going to say, "Are you on BenefitPitch? No, you need to be there first."
Yeah.
And so that's
Good
how
way to get customers.
you
I
got
like
it. We
it.
kind of let them recruit them for us. We still, of course, do our own recruiting,
Mhm.
but we just solved a problem that the industry had. And when you do that, good things happen.
So conferences, you get your brokers to like send folks your way. How are other ways you source vendors? Just to make
I've got
sure your broker clients have like as many options as possible.
Yeah. Well, I'll tell you, don't sleep on the referral network.
Yep.
I am referred people all the time. And I love it. I mean, a lot of people, talk about, you don't have enough time to say no. Seldom do I do that. And listen, I balance everything. So I'm not doing it to my own mental health concern here. It is more of
Glad to hear that.
yeah, I try to say yes because it keeps me sharp. And if I can help, I'm going to help any way I can. So any company that gets referred to me, I usually give them 30 minutes to an hour to talk through what they're
Mhm.
doing, what's their strategy. So that network channel, that network effect is very real. Like I said, 2 to 3 a week, easy. People just getting referred in. That, and I've got some friends in the VC side, and oftentimes they'll say, "Hey, Dave, we're looking at a company.
Mhm.
Tell us what you see. Tell us, could you meet with them? Tell us what you think of them." And
Yeah.
and that helps too, because now I'm getting it from the VC side, from the brokerage side, what I'm able to source on my own through the referral network. All of them, are really effective channels to kind of keep my finger on the pulse of the digital market here, digital health
Yeah.
market.
It's a great model. So Benefit Pitch has created a new series called The Masked Broker. I assume idea that started from The Masked Singer on TV.
We
Maybe
got to
they
be careful.
copied you. I don't know. Uh, no one can tell. But can you tell our audience some more about the series and how it may help answer the following, questions of how do you help support vendors on their challenge to send to employer benefits, and what are the top things a founder should know when going into a broker consultant meeting?
Yeah, those exact questions are the things that come out via this Mass Broker series. It started, working with my broker friends, and they were like, "Dave, can you do something about the vendors who just text us on Sundays and send mass emails and do this?" And it was all these things that vendors were doing wrong. And I said, "Well, why don't we do like a video recording? You can tell them yourself." And they're like, I don't want my face associated
Yeah.
with the guy who's bad mouthing the vendors. Plus, if they know I'm the guy that owns the vendor relationships for this brokerage firm, forget it.
Will
Everybody.
never leave me alone.
Exactly. So I said,
Yeah.
"Well, what if we mask you?" And they're like, "What do you have in mind?" So put some creative heads together with the marketing firm I was using at the time, and came up with the idea of the mass broker. So we've
Cool.
done, I think, 6, 7, 8 episodes. I forget. But it's fun. It's, what are the do's and don'ts when working with a brokerage firm to get in front of their employer clients? And we've heard from our vendor friends, "Dave, this is great. Keep it coming. This is valuable. We didn't know this." And it's things like, don't try to backdoor a brokerage firm. If you're talking to the right person and they say not now, be patient. Don't
Mhm.
try to find another way in, because guess what? That person who you find the way in, they're talking to the initial person. And now you're the sneaky one who's trying to go, side door to the brokerage firm. Or, you know, when it's a regionally based firm, you got to meet with different regional leaders, or whatever it is.
Mhm.
Each brokerage firm has their own nuance to it. We're just trying to open up some of those insights for our vendor partners. And then, of course, if these vendors learn the right way to do it, it should reduce the no-nos that some of the vendors in the past have done for these brokers.
Yeah. No, I think your goal has always been collaboration. Like have the vendors collaborate with brokers, and everyone off, is better for it.
That's
So
right. And by
really,
the
really
way,
good
Norm,
stuff.
I will say that theme comes across in these things. I've heard one of them, she had said, "Listen, we're all in this together to help fix and make better this healthcare and benefit system that we're all, in love with." And I was like, that was really well said.
Mhm.
But there are guardrails, and there's rules, and there's, tips and tricks. And here are some of them. Watch the Mass Broker to learn more. It's kind of a fun idea, and it's really taken off. We're in season 2, and we don't plan on stopping anytime soon.
I'm a big supporter of it. No one's requested to be masked on this podcast yet. Not saying it won't happen. We might do that one day. You never know. Can you walk us through an example of a company you introduced to a benefits consultant that just went incredibly well?
Well,
I'm
this is
sure
a good,
there's hundreds of them, not just one, but like, can
yeah.
you pick out any that's like a really good story?
Right. Well, this is a good time to delineate between my business consulting company and the benefit pitch side. So the
Hmm.
business consulting company, a lot of times it's Dave, we're new to the benefit space. What can we do to work in this space, right? For benefit pitch, I always say we don't pick winners. We let the
Yep.
brokers find what they want, and we are vendor agnostic. If I've got a business consulting client from Sante Nasc on benefit pitch, you'll never know who they are because there's no like Dave loves this vendor on benefit pitch, right?
Yeah.
Um, but it's always been this interesting thing where if I've got, I'd like to think I've got a pretty good eye for a vendor that's doing things a little bit different or better.
Hmm.
And if I can find that and there's a synergy where they want to work with me, I want to work with them, then what has happened over time of the benefit firms that I've gotten to know I'd say the right people at some of these firms, if I knock and say, I've discovered a company, I found a company, or I've got a new consulting client, would you like to meet him? Usually it's a pretty good bet that they're going to say, yeah, I would like to.
Yeah.
I'd say that some of the ones in the past that have had some success with, I don't know if I should be naming names. I'm trying to stay Switzerland, as you well know. I've got benefit pitch. I don't want to favor any vendors. But it was a company in the caregiving space. And I remembered 2 different brokers are like, Dave, no more caregiving companies. I've already met this many. And I was like, do me a favor. If you can make time, take this meeting. And I'm not steering you wrong. I just think that they're different. And one of them met and was like, wow, love them. Ended up asking him to speak at like one of their internal conferences. The other brokerage firm, after meeting him, was like, can you send us a slide that looks like this? Because we have a meeting tomorrow. We already lined up 3 of your competitors. We're going to add you. And I
Yeah.
was like, that's how impactful the company was. I was like, wow, that really was a little bit of a surprise that those 2 brokers both, after saying no, thank you,
Yep.
a little nudge, little take the meeting, and neither of them were disappointed. It was really cool to see.
What advice would you give a vendor that is just starting to sell, through brokers and consultants?
Oh man, there's so much that you can share. One of the
We can do
first
a
things
full hour of that, but if we have to condense it into like a minute.
oh yeah, I'd say first things first, and this is something actually in your role, Norm, you could probably do this, and maybe you already do this. But I always say before you take the job, ask about is it VC backed and what sort of patience the board has. Because if you're going to get into the benefit space, like legitimately,
Hmm.
and sell the right way through brokers and to those employers, it is a 18 to 24-month minimum window to get
Hmm.
started. And so if there's not enough runway, if there's not patience on the board level or the leadership level, like run, do not walk from that job. Don't take it because you're
Yeah.
going to be set up for failure. And so that's number one. Make sure your leadership team, if they've never sold in this space, they have to know this. And not just the leadership team, but all the way up to the board. If you can somehow get that, you're setting yourself up for success. And then from there, patience, persistence, patience, the mass broker folks will always say, be persistent, but not pushy, give us information that we can share with our client. It does take time to build a relationship. So you got to put the time in, you got to be that respectful, patient vendor waiting for that opportunity. And it is a real lesson in patience, I think, in a lot of ways. So those are the bits of advice I put out there.
In terms of benefit pitch, what do you want to be over the next 5 years? Like, where are you taking the company without giving away any trade secrets?
Yeah, great question. This is one of those where I might just tell you wait and see.
Okay, that's
I will
fair.
say this as a joke. It was funny. I was on a call earlier today and was sharing a little bit about benefit pitch and then the RFP side of what we're building. And then I jokingly said, slowly taking over the benefits world. And, there was this kind of chuckle and the person's like, you're kind of not kidding, are you? To me, the ecosystem we're building is valuable. The data we have from all the searches is valuable. Like there's just a lot now. If you're on LinkedIn and you follow me or connect with me, I've started doing this Friday poll. So it's like, what's trending, what's
Yep,
rising,
I've seen it.
that's been kind of fun. And it's been a lot of folks engaging in it. So yeah, I mean, listen, this has been the most fun thing I've done in my life.
Mhm.
I say professionally, family, of course, first.
Yeah.
Wife and 2 kids. And I'm one of a big family. I've got 7 brothers and sisters, just love all of that aspect. But on the business front, I did corporate, learned a lot, but I have been having so much fun on my own. And so I don't have any plans to kind of let up off the gas at this point. I think it's a matter of, what next could be multiple different things. And I guess it will be kind of a wait and see.
Yeah, you're one of the first people to see like a new benefit offering, because one of the first thing someone is advised to do is get on BenefitPitch so that brokers and consultants can have some information about you and know you exist. So
Yep.
I guess in your opinion, like what are some newer innovative markets that you're bullish on that you think will be like the next 5, 10 years is current, like diabetes, musculoskeletal, mental health, fertility? Those seem to be, care nav are like probably the 5 most common
Yeah,
benefits out there. What do you think's like the next wave?
that's a tough one. As much as I am a happy-go-lucky, optimistic sort of guy, I will say that if you just kind of read tea leaves right now, we went from like a pendulum swinging back and forth. Pre-COVID, it was like a benefits arms race. COVID hits, pendulum swings the other way. Everyone's out of work and just trying to find jobs. And then people start to come back to work. So they start off from benefits to get people back in the office. And then people are back in the office and there's this inflationary market and like, will there be a recession? And there's this ping pong match going back and forth. It ultimately has caused the industry to look at things and really assess, what are we doing right? What are we doing wrong? Are we placing the right vendors? How are we measuring them? So I think that there's a lot to be said around simplifying to an extent what you're doing and making sure whatever you offer is tied into the 2 tenets of attraction and retention and cost containment. And I think those are the 2 reasons why, employers offer benefits, and if they're self-funded, they want to control the cost. They want to offer benefits that are impactful to their employees. And if you can find whatever that right mix is for any industry or individual, if you're trying to meet the needs of many, I think that lifestyle spending accounts, ICRAs, there's a concept there that's like, this is interesting. If you can let people get what they want versus kind of trying to fit, boil the ocean, fit it into a benefits package and hope to God there's engagement. I mean, that is the challenge of employers and brokers today and the vendors that serve them. But I mean, there's core tenets. Behavioral health is not going anywhere. Like it is just a staple now. And it's funny. 5-10 years ago, people, they got it. It was all whisper. People didn't want to talk about it.
Yeah.
You have an issue, don't say anything. I'm a Gen Xer. It was a suck it up. Don't talk about it. Don't tell anyone. Stiff upper lip, all that. Nowadays, much different. So I think that any evolution there, and it can be, I've seen peer-based counseling, so it's not clinical, but it's peer-based, peers who've gone through a similar experience.
Yeah.
I've heard about the psychedelics and ketamine-assisted therapy. Fascinating to me. And one of my friends who's a doctor came at me at a conference, Dave, you got to look into this. And he was bullish on it. And he's not a guy who gets bullish about much. So those 2 things really stuck out as, let's keep an eye on this. But I think the other area, and I'll kind of wrap it with this, is if there's a way for a group of vendors, a platform to do better, meaning there's selection, there's opportunity, there's engagement, there's the right data being pushed to people at the right time. If someone can solve that problem, and there are people trying now, but if it can be solved in earnest and actually drive engagement, because again, don't worry about return on investment initially, it takes time. You got to engage the population. If the engaged population use it, then you have an opportunity to move the needle into ROI. And anything that doesn't meet certain criteria of engagement and ROI will quickly be, discarded in a future state, because this benefits industry has gotten kind of fat and happy, and costs are going to get trimmed, and mergers and consolidations are coming, and, less VC dollars powering things. At least I'll say less, more carefully placed VC dollars, I guess is what I'll say.
Yeah. No, I think there's way more scrutiny now than there was 5 years, 10 years ago. So I think it just puts an even bigger burden on vendors to really convey and show value up front. And, I've seen plenty of companies able to do that. So I'm still bullish, but yeah, it's not as easy as it used to be.
You and me both, but it's a matter of like, when you see certain things, I came across a company, a friend of mine just started working there, and I heard the pitch and I was like, this is intriguing, very intriguing. It was around, transparency, I guess is what I'll say. So if you see that sort of transparency play, I think that the future benefit leaders, those who are Gen Y, Gen Z that are moving into benefit decision maker roles, they're going to expect different. And any old guard that's not willing to really put their money where the mouth is, show transparency, et cetera, I think you're going to see people move off those solutions, regardless of the vertical. It's going to be almost the relationship side of, do you trust this person to be transparent and whatever the costs are?
Yeah. Completely. So I ask everyone who comes on this podcast, not only what do you know and what have you done in healthcare in the industry, but what do you do as just yourself, to make sure your sound body, sound mind, from a wellness and exercise and stress reduction standpoint, what do you do to be peak Dave, the best version of Dave?
If I told you I was a retired power lifter, you'd look at me and wouldn't believe me. And you're right, I'm not a power lifter. I'm a runner. I've been a longtime runner. I was a high school and collegiate athlete, sprinter, coached, been running since I was a sophomore in high school, I guess. And so for me, that morning run, and I am a morning run guy, nothing crazy. I mean, I've done a couple of half marathons, but usually it's like 5K, 10K. Makes a huge difference for me from just staying in shape standpoint. I don't just jog it. I try to really train it. And, if I'm in peak training shape, I'm kicking around a 7-minute mile, which there are people who do
That's
way
very
better,
good.
but I'm pretty proud of my 7-minute mile, right?
That's awesome.
And, I'm not there now. I had a little injury, a little health thing, and I was like, all right, I got to work my way back, which is humbling as all hell, but here I am still doing it. Went out for a run this morning. That is both my physical and my mental wellness, because when I run, I never wear headsets, no music. I am nature, listen to the birds, listen to the water, listen to my footsteps hitting the pavement. It's very, cathartic for me to really just be, in myself at that moment and think about my day, think about my life, think about my family, my business, my own mortality, like whatever it is that's running through my head. But yeah, running is my thing.
Yeah, and I think, what you put into your body is obviously a huge determinant of how you're going to feel and how you're going to be able to respond to anxiety and stress and, different things. So something on this podcast I've been asking is, what's a healthy recipe or recipes that you make at home that maybe gives someone else the inspiration to try something maybe they haven't tried before?
I don't know if I'm the right guy for this. I love steak. I love ice cream. I don't have it all the time.
If it works.
No, you know what it is? It's the everything in moderation. And, for example, the other day, my daughter grabbed like a ice cream from the freezer and she's like, "Do you want one?" Well, I had not been running. I had weighed myself. I'd gained 2 pounds, and I was like, that just a little bit of self-discipline, I think, helps. I will say this, my oldest daughter has celiac. And so a lot of what we do in the house is gluten-free. And my wife is, practically a vegan. She's not quite there. She's a vegetarian, and she eats super healthy. And I'm blessed to have, a person who is, she's from Mexico, Mexican woman who takes good care of her man here, and God, I'm lucky to have her. She is the one who does the cooking in the house. I don't typically do much of the cooking, but I'm usually I'm a light eater. I don't eat a lot. So a lot of folks are like, "That's all you're eating?" I'm like, yeah. So for me, portion control, knowing that self-discipline side of things. But to answer the question, that was a long, roundabout answer, or not even answer. But my wife has gotten into making these little bowls, Mexican bowls, poke bowls. So it's got quinoa, it's got greens, it's got this, and just a little bit of protein. They're filling, they're tasty, a little bit of sauce, nothing too crazy, nothing that's gonna, make it too fatty. But those are kind of nice little things that I've enjoyed having from time to time. It makes me feel like I'm taking good care of myself.
Yeah, no, when you have a bowl that has everything you need, it's got grains, it's got vegetables, it's got healthy fats, it's got protein,
Yep.
Those are the best.
It really is. They're filling, and I just get excited about it. It's like, this is good.
Yeah, very, very good. Well, Dave, really, really appreciate you spending some time on the podcast. I've been seeing you for many years. I finally asked you, Dave, what do you do? And now for anyone who's ever wondered that, you know what Dave does, super valuable for the industry. We're really lucky, to have someone that's really able to meet the vendors and the consultant brokers at the intersection and really facilitate some really, really good collaboration. So again, Dave, thank you for joining us on the Digital Health Heavyweights podcast, and thank you for all you do.
Norm, it's been a pleasure being on the show. Thank you so much for having me.
All right. Thanks, Dave. Appreciate it. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.